It's my privilege to welcome Dr. Amritha, who's here with us. Welcome to the studio,
Thank
Doctor.
you. Thank you so much.
My first question to you is, as you come from the pediatrics field or sector, could you tell us your general approach and specialized areas, please?
So I'm basically a pediatrician.
Yes.
I've been working in Mysore since last 10 years. This is 11th year. So I'm also a lactation consultant, an IBC LC certified lactation consultant.
Yes.
So I'm a pediatrician and a lactation consultant.
Yes. So you do agree, and all of us do agree with that, like when you are not a mother, when you're not married, and when you are a pediatrician, there are certain instincts that is out of reach. But when you yourself are in that position, and the instincts are different. Would you like to elaborate on that, please?
Yeah, so I believe that breastfeeding is a nature that comes naturally to a mother, should come naturally to any mother. Once she delivers a baby, she should know how to feed her baby.
Yes.
It shouldn't be taught.
Yes.
And there is no position, attachment, nothing should be taught. It is an instinct. She should just follow her instincts and she will be right.
Yes.
But when they do have problems, probably, due to a lot of things, the baby might be in NICU or, the baby might be sick and she might have some hormonal issues, unable to lactate and, something going wrong. That is where we come into the picture.
Yes.
So I think when there is a problem is where our role comes in. Otherwise, it's an instinct and it shouldn't be taught is what I believe.
Yes. And my question, after listening to your description and explanation, now this modernization to a certain degree has interfered with the natural mother's instinct, because mother's instinct pulls in a natural way. But the globalization has pulled her to so many dedications or involvements, which is a need of the hour. So is it true?
Only 30 to 40% mothers are doing exclusive breastfeeding worldwide, at least up to first 6 months. So the exclusivity of breastfeeding is declining, probably because of modernization. I don't say mother shouldn't work, but now we need to figure out how she can work also and feed her baby also without giving any breastfeeding substitutes like formula or anything else. What we as lactation consultants and basically a pediatrician, what we do is we figure out a plan that works for that person. So we help the mothers put a plan what might work for them, what is best suitable for them to practice exclusivity of breastfeeding.
My next question to you, Dr. Amritha, is there are several reasons why mothers, first-timers or second-timers could be, are unable to breastfeed, right? I mean, there are several reasons for it. Now, anything that you would like to inform us about these so-called reasons? What could be social reasons or cosmetics could be, or it could be genuine illness.
Common reasons are probably elderly primary. So these hormones are very important for a mother to lactate. So we see a mother who has gestational diabetes, who's had PCOD history, or who's had lot of chronic illnesses. Their lactation is a bit lower than rest of the other mothers. Elderly primary, what I said, having the first baby after 35 years. So these are the common reasons what we see, the early weaning of breastfeeding, what is happening worldwide. We also see a lot of mothers give up on feeding after first month, second month. Those reasons are very different. Maybe baby is gaining weight slow, demotivation, and lack of support from family. The whole burden should not be only on the mother. The community has to play a role. The family has to play a role. Husband has to play a role. If you put the whole burden on the mother, she is going to wean off breastfeeding because it's too much of a stress. Feeding and managing your career is not easy, right? And even at her workplace, how can we support the mothers who are feeding? How can we support them? I think that is also very important. It's everybody's duty to help a mother feed her baby as long as possible. And whatever help we can, I think we all should.
Now, talking about breastfeeding, especially the new mothers. Is there any medical conditions in which yourself as pediatrician would tell them not to breastfeed?
Only one or two few cases where we say a mother has herpes simplex, lesions on her nipple, or a varicella zoster, which is chickenpox, lesions on the breast area. Direct contact, because a newborn is susceptible to these viruses, and these can cause a bit of a fatal viral infections, viral encephalitis in newborn babies. So we ask the mother to wait till the scab is formed, the crusting and the scabbing of the lesions, and then feed, probably after 2 weeks. That is only if the lesions are in and around the breast, not otherwise. That is one contraindication to breastfeeding. Number two, when it comes to HIV also, we encourage mothers to still continue feeding, but we do start the baby on prophylactic medicine. When a mother is HIV positive, there is no contraindication. We call it as an AFAS criteria. Now this comes into picture where we counsel the mother, if you're affordable, if it is sustainable, you can still go ahead, and if you think that I don't want to take even 0.0001% of my baby getting HIV from my breast milk, then you can go with formula. Because we cannot guarantee that this virus will not be passed through the breast milk, right? But studies have proven that if the prophylaxis has been started to the baby from day one, even if she feeds, there are very minute chances of the virus passing to the baby. And for all you know, breast milk will always, give that kind of immunity to the baby, where it can be, able to fight all the diseases, prevalent diseases. So we explain this thing that you can give formula or you can continue breastfeeding. It is up to the family. So these are the only conditions where probably we say it is contraindicated.
Well, thank you very much for explaining to us about it. When is it ideal for a person to stop? That is the weaning process from the natural breast milk to the supplement available. So would you like to share any ideas about it?
So the WHO and IBCLC guidelines, what they suggest is, from the time the baby is born, the first 6 completed months, you have to give exclusive breastfeeding, breast milk. After 6 months, start solids, but the breast milk has to go on till 1 year, minimum 1 year. But if you can continue until 2 years, it's excellent. But the role of breast milk after 1 year is only for immunity, not for nutrition. In the first year, it's for nutrition. After 1 year, it's for immunity. So we encourage mothers to breastfeed at least until 2 years. But they can start solids after 6 months. Now again, as a pediatrician or a lactation consultant, I don't say formulas are wrong. We do use it when it's required. But there are certain indications where formula has to be started. But even if it is started, it is the pediatrician or a LC role to probably teach the mother how to taper it and stop as soon as possible.
And what might be those indications?
So for example, a 3 kg baby, a weight loss more than 300 gram is an indication to start top-up feeding. Other reasons are, as I told you, baby is in NICU, on tube feeding. And mother is not able to lactate, say 20 ml. The baby's requirement is 20 ml every 2 hours once. Probably that is when we use formula. Those are the temporary use, and then we work on the mother's lactation and we slowly wean off the formula. But what we see usually is that formula is not weaned off. It is started, but nobody is weaning it off. And eventually what happens, the mother's milk goes low. There are reasons for that. You go on increasing formula, mother's milk goes low, and eventually the baby will be in formula.